Hello, and welcome to the North Carolina Community Health Center Association. My name is Michelle Lewis. I am the CEO with Triad Adult and Pediatric Medicine, commonly known as TAPM, TAPM, located in Guilford County, North Carolina. And I also serve as the Vice Chair of the Board of Directors for the North Carolina Community Health Center Association. Triad Adult and Pediatric Medicine holds a unique space in Guilford County, as for decades, we have been the forerunners in delivering affordable, accessible, quality, and value-based primary health care in Guilford County. TAPM has been around for over 23 years. However, we became an FQHC in 2013, so we're still FQHC babies and learning every day. We have 5 locations in the heart of Guilford County, North Carolina, and we offer primary health care, integrative behavioral health, and a host of other services, including a formerly incarcerated transition clinic, assisting those recently out of prison or jail with healthcare needs and resources to assist with acclimating them back into society. We also have a very large pediatric practice and often serve our patients from birth through adolescent to mature adulthood and even geriatrics. I'd like to personally thank each of the reviewers, consultants, and observers, and I would also like to welcome you to the virtual site visit. I would also like to thank Chris Shank and the North Carolina Community Health Center Association leadership team. Many team members are new and learning all the nuances of the PCA and the FQHC world, and some have been around to witness many goals and plans coming to fruition. Either way, we're all here on this journey together as a PCA. Who we are as a PCA. North Carolina Community Health Center Association develops state-level partnerships and engages with state agencies, funders, and national organizations on behalf of community health centers in North Carolina. We hold a health center controlled network, HCCN grant from HRSA. We are also part owner in and managed services provider for clinically integrated network of FQHCs, Carolina Medical Home Network, LLC. On a personal note, the PCA has been a rock for our health center, specifically during times of financial difficulties and staff shortages. Their expertise guided me as a new CEO through many rough days, and there are testimonies from many of my peers of similar positive experiences. Over a year ago, we were confronted with the novel coronavirus, and now we're dealing with an even deadlier form of the virus, the Delta variant. The pandemic forced communities to work together and caused community health centers like TAPM to redesign and reimagine healthcare. For TAPM and other health centers, the North Carolina Community Health Center Association became a lifeline, leading and guiding us through local and state contracts, as well as the implementation of telemedicine. Education and prevention continues to be a key factor in our health center's COVID-19 efforts. Our goal and our mission is clear. Health equity and health equality is in the forefront, and the North Carolina Community Health Center Association, FQHCs, are definitely leading the way. Leading the way by addressing the social drivers of health, and now leading the way with equitable vaccine distribution and testing. The PCA thrives on providing for the whole family and the whole person. We believe that all people, regardless of income or socioeconomical status, deserves access to good and affordable health care. The PCA continues to leverage and enhance partnerships with the goal of helping each underserved community in North Carolina. I would like to highlight just a few of the North Carolina Community Health Center Association's strengths and assets to its members. Stable, dependable CHC funding, partnerships with professional associations, membership services, work groups, training and technical assistance, university partnerships, workforce development, and recently the transition to Medicaid managed care. These are just a few of the strengths of the North Carolina Community Health Center Association. What has been amazing to me is how the association leadership has managed the PCA, the Carolina Medical Home Network, the Clinically Integrated Network, and the Health Center Controlled Network. As a member, I can say without a doubt that the North Carolina Community Health Center Association lives up to its mission and its vision. It is our PCA's aim and ambition to support, grow, and cultivate each community health center in North Carolina. And Chris and the team are doing a stellar job. So on behalf of Chris Shank, the president and CEO of the North Carolina Community Health Center Association, Reuben Blackwell, board chair, and the board of directors and its 42, including funded health centers, 3 lookalikes, 3 combination health centers, we welcome you, and we are confident that you will find the North Carolina Community Health Center Association to be a PCA second to none. Thank you for your time.